Greetings to all participants. I'd like to thank the moderator for the introduction, and many thanks to the organizers of this webinar for the opportunity to speak with you on this topic. Let me share my screen and begin the presentation. So I will be speaking to you today about the baseline survey on healthcare waste, capacity, and national policy in the 5 project countries. The UN Development Program, in partnership with the government of China, is conducting research in 5 project countries. And these are Cambodia, Lao PDR, Myanmar, Nepal, and the Philippines. The objective of this study is simple. It's to better understand what are the most pressing issues concerning healthcare waste management in those 5 countries. In a later phase of the study, the research team will implement behavioral insight experiments based on the issues identified during the baseline study. Ultimately, this all aims at encouraging more sustainable and improved healthcare waste management systems in the project countries. Now, I would like to make a few points concerning terminology that we are using in this study. It has been my experience that the term medical waste can mean different things to different people. Some people understand the term to mean only sharps and infectious waste. Others may have a broader understanding of the term that might include, for example, expired drugs or chemical wastes. Many people would exclude non-hazardous waste from the definition of medical waste. So that would include things like paper from the offices or packaging material. And we know particularly during the COVID pandemic, there has been a lot of packaging material generated in healthcare facilities. So in our study, we are using the term healthcare waste as defined by the World Health Organization. And this includes all waste that's generated within healthcare facilities, whether it is hazardous or not. It also includes waste generated for the purpose of healthcare at household level. Here we see a few notes on the methodology for collection of data and information. As I mentioned earlier, this study is ongoing right now, and we are still collecting data and information. Quite simply, data and information are being collected in 2 ways, through literature search and through supplementary methods such as questionnaires or surveys and interviews of key informants. The types of intervention are the types of information that is being collected are described here on the slide. It includes national legislation, policies and regulations, technical guidelines, the institutional or governance arrangements and key stakeholders who are involved in this issue, and also relevant studies on healthcare waste management in the respective countries. And all of the 5 countries have had some studies done on this issue in recent years. Stakeholders, stakeholders who are involved in this issue are divided into national stakeholders and regional stakeholders. At the national level, government agencies such as ministries of health, ministries of environment are important, but also local government bodies. These are also key stakeholders. Other stakeholders at the national level include healthcare facilities, service providers, NGOs, hospitals and professional associations, and external development partners. At the regional level, we have UNDP, of course, plus the Asian Institute of Technology, which has conducted a lot of research and put out important publications on healthcare waste management in Asia. We have the NGO Healthcare Without Harm and the regional offices of the World Health Organization and the UN Environment Program. And all of these regional bodies have been interviewed or are in the process of being interviewed as part of the study. To analyze the information that is being collected, we have developed a framework of assessment in order to benchmark policies and practices at national level vis-a-vis international guidelines and best practice. The parameters that are being analyzed are shown here in the second bullet point. These include policy and regulatory framework, waste generation rates, waste management practices, the technologies that are employed for waste treatment, also issues such as training of healthcare workers and public information and education. Compliance with international guidelines or best practices and compliance with national regulations are a key point in our analysis. Now, we have found that Gavi's healthcare waste management maturity model is a suitable tool for benchmarking healthcare waste management systems at national level against international guidelines and best practices. Gavi, for anyone who may not know, is the Global Alliance on Vaccines and Immunizations. This approach allows a very broad assessment of the country's healthcare waste management systems, looking at people, processes, and technologies as shown here in this slide. Now, this slide may be a bit difficult to read. I apologize for that, but it shows that each area of assessment, which is shown in the rows, can be assessed at a level of 1 through 5, with 1 being the lowest level of assessment or the least developed level, and 5 the highest developed level. This is a qualitative assessment which is appropriate for our study, given the nature of the data and information that we are able to collect. We plan to adapt this model, however. We want to add something to it in order to add an element of looking at how disaster risk reduction is incorporated in the country's healthcare waste management systems. Now, I would like to discuss some preliminary findings of the study. As I mentioned, the study is still ongoing. So what I'm really presenting here are my impressions based on information that we are seeing so far. With regards to countries' policies and regulatory frameworks, the 5 countries generally had well-developed frameworks, even prior to the COVID-19 pandemic. However, enforcing compliance with national policy and regulations has been a challenge for most countries, especially outside of urban areas. As a result, many healthcare facilities in the region, or particularly in the project countries that we are looking at, were already experiencing deficiencies in healthcare waste management before the pandemic occurred. They were not well prepared to safely manage the increased quantities of healthcare waste, which came about due to the pandemic and which continue up to the present time. Another preliminary finding here pertains to survey data. We found that data on healthcare waste management are not very extensive in most countries. Each of the 5 countries do have some survey data, but it's not very extensive. Lao PDR is a notable exception to this, as Lao has conducted a survey of 1,225 healthcare facilities. Nonetheless, not only are data limited in most countries, the data are also not comparable between countries because the countries have used different indicators in their studies. Because of this, the available data is suitable for a qualitative approach to benchmarking rather than a quantitative one. The Gavi maturity model, which we looked at earlier, is a qualitative approach, and we feel that it's appropriate and quite suitable for our purposes. This slide shows some of the most pressing issues among the 5 countries that we are studying. I want to emphasize once again, this is my personal impression based on data information that I've seen so far. These findings have not been validated at this stage. So I have grouped the preliminary findings into 3 areas that correspond to Gavi's healthcare waste management maturity model. That is people, processes, and then technology and equipment. With regards to people, as I mentioned, we are finding that the countries are challenged to enforce compliance, especially outside of urban areas. And as a result of this, unsafe waste handling practices are common, or at least we can say they are not uncommon. Very frequently, we find there is insufficient supervision and monitoring, which contributes to this situation. Frequently, there is also insufficient numbers of healthcare waste management workers, and these workers have little opportunity for training. So frequently, their knowledge base and their skills are not suitable for the task of safe healthcare waste management. One other finding, preliminary, that we are seeing is that there has been little emphasis placed on public education, and as a result, poor healthcare waste management practices occur at the household level. Regarding processes, once again, I would like to mention that the countries generally did have good policy and regulatory frameworks on paper. Again, the problem was with enforcement, but other issues that we have identified in a preliminary way with regards to processes are limited here. Poor record keeping and data analysis is generally the rule. Secondly, there is little emphasis on waste minimization. We find emphasis in the policy and regulatory framework on managing wastes, but not much emphasis on minimizing waste. And thirdly, there is almost universally insufficient financial support for healthcare waste management. In the third category, technology and equipment, we often find that equipment for collection, transport, and storage is frequently insufficient or poorly maintained. We find that waste treatment equipment, whether it be autoclaves, microwaves, incinerators, or anything else, is frequently absent or malfunctioning due to poor maintenance or lack of maintenance. And then finally, poor waste disposal practices are not uncommon. There are many instances of indiscriminate dumping, open burning, and practices like that. So this study is ongoing. We will be continuing the study in the coming weeks and months. This slide is showing the research team led by Mr. Sani Gigalos of UNDP and Ms. Suin Bang. I am the technical lead consultant for this study. We have colleagues in each of the 5 countries within the UNDP country offices, as well as national consultants who are carrying out the research at the country level. So I wish to acknowledge them all and thank them all. And once again, I thank the organizers, particularly the government of China, the Basel Convention Research Center, China Aid, and the UN Development Program for the opportunity to present this study. I hope it has been useful and helpful to you. Thank you very much for your attention.